Namaste. Good afternoon to all our viewers. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, medical writer, and a budding YouTuber. So, on my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally, I come up with discussions on different aspects of Ayurveda, mental health, and psychotherapy every week. So, today's topic of discussion is post traumatic stress disorder. As you can see in my background, PTSD. I had got requests from many of our clients and our subscribers and viewers that I have to do, a session on what is trauma related stress. So, this is the actual word for that, post traumatic stress disorder. We are going to know everything about what is post traumatic stress disorder and how does it impact the mind and the body, what are the causes, what is the incidence, and what are the symptoms, and how do we manage. We'll see how much of it we can cover today, and if it is not covered completely, we'll take up another session on post traumatic stress disorder. So, without wasting time, I'm going to start. See, post traumatic stress disorder, as the name itself indicates, that this is because of this stress is because of a trauma. Now, the definition goes like this. See, post traumatic stress disorder is a mental health condition that is triggered by a terrifying event. That means something bad happening. See, either experiencing something terrifying or witnessing something terrifying. That means symptoms may include flashbacks, nightmares, severe anxiety, as well as uncontrollable thoughts about the event. So, post traumatic stress disorder is a mental health problem you may develop after experiencing traumatic events. See, the condition was first recognized in war veterans. This came into existence after it was, seen in war veterans. It was called by different terms in the past. We'll not go into that. But, so what exactly is it? So the post traumatic stress disorder is a disorder that develops in some people who have experienced a shocking, scary, or dangerous event. That means it is, see, we all experience some scary or dangerous events in our lifetime. It is natural to feel afraid during and after traumatic situation, but fear is a part of our fight or flight response. I have talked about the fight or flight response earlier in my videos. So this fight or flight response helps us, avoid or respond to potential danger. It helps in both. Either we can avoid or either we can respond to the potential danger. That is common. But here in post traumatic stress disorder, here, it is different. See, people may experience a range of reactions after trauma, and most people recover from the initial, symptoms over time. Those who continue to experience problems may be diagnosed with post traumatic stress disorder. See, after the traumatic incident, we all tend to forget and recover over a period of time. So even after a period of time, even after a month or so, if the symptoms continue, if there is unnecessary fear, anxiety, or stress regarding the event that triggers the event, the flashbacks of the event triggers that individual, then that is PTSD. Otherwise, it is normal, it is natural to have a response to a trauma. So who gets PTSD now? So who what all persons, in what all conditions we can see PTS? See, anyone can develop PTSD, that is post traumatic stress disorder. It may be developed in any age. This includes, combat war veterans as well. And they see bombing, they see terror. First, when it started like this. They used to experience terrifying, horrible events, or they lose some of their colleagues, some of their co-workers. This disease, this disorder developed like this. And see, people who have experienced or witnessed a physical or sexual assault, people who experience assault, abuse, maybe a physical accident, or people who experience disorder or serious health events, people who have PTSD feel stressed or frightened even when there is no danger. See, this is unreal. The event has already happened. Yeah, either they are victim of that event, or either they have witnessed the event. So, and one more thing is, not everyone with the stress disorder, the traumatic stress disorder, that is post traumatic stress disorder, has been through a dangerous event. Not everyone goes through a dangerous event. They may have witnessed something wrong. And sometimes learning that a friend or family member experienced trauma can cause PTSD. See, according to the National Center for PTSD, there's a Center for Post Traumatic Stress Disorder. It is in US. So uh, you know uh, that also says that every 6 out of 100 people experience PTSD. That means 6% of the people who have stress are stressed because of the post traumatic stress disorder. Either it may be a physical or sexual assault, either it may be a abuse, either it may be a accident, either they have seen a disaster, or a hazard, or loss of loved ones. Because of all these reasons, so, see, and it is said that women are more likely to develop PTSD than men, slightly greater ratio. Though men also can develop PTSD, women tend to develop more. A bit of the ratio is more. So, certain aspects of the traumatic events and some biological factors, such as genes, you know genes also, that is genetic material. Genes may also make some people more to develop PTSD. So what are the signs and symptoms of PTSD here? So what a person experiencing post traumatic stress disorder, what all signs and symptoms he might experience? So symptoms of PTSD usually begin within 3 months of the traumatic event. So symptoms usually begin within 3 months of the traumatic event, either the terrifying event they may be the victim or witnessing, both. But they sometimes emerge later, even after 6 to 7 months of the event. The PTSD may develop. So to meet the criteria for PTSD, a person must have symptoms for longer than 1 month, and the symptoms last for a longer duration, more than a month. Whenever he or she experiences symptoms, the symptoms are last for longer than 1 month. The fear, the stress, the anxiety lasts for more than a month, and the symptoms must be severe enough to interfere with aspects of daily life. what it does, why any abnormality, it is called an abnormality because it impacts your daily functioning. It interferes in your, daily aspects of life, your productivity, your work life, your personal life, your relationships, or your, professional relationships. Everything gets affected. That is the cause of worry in any mental health disorder, not only in PTSD. So the symptoms also must be unrelated to, medication, substance use, or other illness. See, it is not that it to completely, it might be, the reason might not be something physical, or something related to medication, or something related to all alcohol and tobacco. This type of stress is not developed, might not develop due to all these reasons. The reasons may be simply a trauma or a hazard, or any witnessing any danger, or going through a loss of a family or a friend. So the course of the disorder varies here. See, some people recover. Here the recovery also depends on the individual. If it depends on the strength of the mind. In Ayurveda we call sattva bala. How strong is the person, and how willing is he or she to recover, that also depends. It varies. People might recover very fast, some people might not recover very fast. It may take years for them to recover, and still they may be on therapies and medications. So usually people recover within 6 months, while others have symptoms that last for a year or longer, as I said. See, people with post traumatic stress disorder often have co occurring conditions such as depression, substance use, or more anxiety issues. See, here I said that I have contradicted my statements. What did I say? That means both can happen. I said that the substance use, alcohol, or the medication, or it might not be a cause for uh, this post traumatic stress disorder. But when you have post traumatic disorder, it may be a, don't get confused, a comorbidity, such as they might have comorbidities such as depression also. They might also have substance abuse because of that depression, because of that stress. As a coping mechanism, they might use drugs, they might use all alcohol, they might use tobacco for, coping with that stress or depression. So one or more, anxiety disorders, they might be having one or more disorders, though these might not be the direct cause, but these might be co-occurring, coexistent. That is what the point is. And after a dangerous event, it is natural to have some symptoms. So for example, some people may feel detached from the experience, as though they are observing things rather than experiencing them. See, here symptoms might vary. Some people might feel they're still experiencing that horror, they're still experiencing the terrific event. When there is a physical abuse or sexual abuse, after over a period of time also, they might feel that they're experiencing that horror once again. And some people might feel that they are not experiencing it, but they are visualizing it. Some people may have the sensation of visualizing it, some people may have the sensation of experiencing it. So you know a mental health professional who has experience in helping, if you see a family member or your friend or yourself, you're experiencing any of these symptoms, you have gone through any childhood trauma or an adult trauma, you have to approach a mental health professional. So you can approach a psychotherapist or a psychiatrist. See, they can help you diagnose. And see, sometimes what happens is PTSD is not even diagnosed. people are having stress, people are feeling anxious and having the symptoms, but the post traumatic stress disorder is not even diagnosed. So how do we diagnose symptoms? So at least one re-experiencing symptom, the symptom should be reoccurring. That means you have to have the same flashbacks, same vivid visualization, whatever it is there, it should be re-experiencing, or at least one avoidance symptom. See, avoidance symptom is avoidance here is if if something wrong has happened in a social gathering, let's presume that person, he or she will avoid that social gathering, that is called avoidance symptoms. Or anything has happened in the workplace, that person will not be willing or avoid to go to workplace or public events, so that is called avoidance symptom. And at least two cognition and mood symptoms. There are also cognition and mood symptoms where we'll talk about all the symptoms in a minute. But we will usually all the if all the symptoms are there, depending on that, a mental health professional will diagnose it as this, post traumatic stress disorder. See, here, re-experiencing symptoms. I talked about re-experiencing symptoms. See, experiencing flashbacks. Flashbacks is relieving the traumatic event, including, physical symptoms such as racing heart. It may be, associated with racing, increase in the heartbeat or sweating whenever you have the flashback or the visualization of that event. Whenever that person experiences that event, it might be associated with some physical symptoms as well, that is increased heartbeat, palpitations, sweating, all these might happen, or trembling. Sometimes it is different for different individual, it is not the same for everybody, because the kind of trauma also is different. So, having recurring memories and dreams related to the event, and while sleeping as well, they'll dream, because that is going on in their head. They dream of the same event, and they have recurring memories of the event. They're not able to forget that event and move on. Having distressing thoughts that this event might happen further, once more. This pain might be completely unrealistic, but still they will feel that this thing will happen once again. So, experiencing physical signs of stress. See, sometimes stress and post traumatic stress disorder can be very tricky, because the symptoms of the stress also will be seen here. In some cases, diagnosing may be tricky. So, thoughts and feelings can trigger these symptoms as words, objects, and situations that are reminders for the of the event. So, see, what are the avoidance symptoms? So, I talked about avoidance. Avoidance means avoiding something, avoiding a public gathering, avoiding an event, avoiding to meet a friend or a family member, avoiding to go to work. Avoidance is that. So, staying away from the places, from the events, or staying away from the objects that are the reminders of the traumatic experience. So some place might remind them of that traumatic incident, some event might remind them. So avoiding thoughts or feelings related to the traumatic event, to cope up with their trauma, what they do is they avoid thoughts or feelings related to the traumatic event. So, what happens is these avoidance symptoms may cause people to change their routines. What majorly happens is they change their routines. For example, some people may avoid driving and or riding a car because they have experienced an accident while they are driving a car or a vehicle. Maybe they avoid driving because of that accident, and because they've experienced an accident, they completely avoid driving, that I'm not worthy enough of driving. This might happen. And there are other symptoms called arousal and reactivity symptoms. So being easily startled, irritable, they are very irritable, easily irritable. They feel tense on and feel always on the edge, and they have, as I said, they have cognition symptoms as well. They have difficulty concentrating, have difficulty falling asleep or staying asleep. Sleep is disturbed in every, mental health disorder. Sleep disturbance is a common symptom. Feeling irritable and having angry or aggressive outbursts because they remember their trauma is recurring, the flashbacks of the trauma are recurring. They have angry and aggressive outbursts. And engaging in, because of these, to cope up with that, engaging in reckless or destructive behavior can be, in behavior, or adopting a hobby, like, smoking, drinking, drug abuse, all those things. So, and cognition symptoms. See, cognitions and mood symptoms here is having trouble remembering key features of the traumatic event. See, they remember some parts of the incident really well, but the key features to describe the event, they have trouble remembering that. They have negative thoughts about themselves and the world. They might have suicidal thoughts as well, and they might have thoughts like, I am not worthy enough of survival, or having exaggerated feelings of blame directed towards oneself or others. They might blame themselves for the incident, and or they might blame some others for the incident. This may be completely unrealistic. So having ongoing negative emotions such as fear, anger, guilt, or shame. So they always have either fear, either anger, either guilt, or either shame, and they lose interest in all the enjoyable activities. Earlier, what all activities or hobbies they used to enjoy, they lose interest in everything. Having feelings of social isolation, as I said, avoidance. They always feel like being isolated. So having difficulty feeling positive emotions such as happiness or satisfaction. See, as I said, this PTSD is a mental health condition that arises in response to experiencing or witnessing a traumatic event. So, this event is often one that involves the threat of death, serious injury, or sexual violence. We see many cases of, women developing PTSD after the physical violence or the sexual violence. So people with PTSD, that is post traumatic stress disorder, may experience a range of symptoms that persist long, after the traumatic event has occurred. So including intrusive thoughts is, inside the mind they have negative thoughts, maybe that I am not worthy. They may self blame, they have suicidal thoughts. People experience different intrusive thoughts, flashbacks, nightmares, avoidance behaviors, negative changes in the mood and thinking, and heightened arousal responses. See, these symptoms can significantly impact a person's daily functioning and quality of life. The main thing which is impacted is the quality of life. The holistic wellness is impacted here. See, what all are the causes of the, PTSD? As I said, traumatic event. See, the traumatic event may be anything like exposure to a traumatic event such as combat, natural disasters like, earthquake, a volcano, or maybe like that as well. So, and accidents, assaults, abuse, violence, these are the primary triggers for PTSD, that is post traumatic stress disorder. See, the intensity and the nature of the event play a role in determining its potential cause. See, what is the intensity? How much is it impacting the person's life? what all symptoms he or she is experiencing. All these, the intensity of the disorder also is important while determining the potential cause. And it may be personal factors also may contribute to PTSD. What are individuals with a history of mental health disorder? That means I said they have a a mental health disorder, and they might have experienced some previous traumatic experiences in the childhood, or they have a family history of mental health issues. Those people are more susceptible to develop post traumatic stress disorder. Coping mechanisms: see, people with limited coping skills or inadequate social support networks might struggle to process and recover from a traumatic event, increasing their risk of developing post traumatic stress disorder. They have some other mental health condition, and they have limited coping skills, or their sattva bala, as I said, is low. Then also it will give rise to post traumatic stress disorder. There are some neurobiological factors, that means certain areas in the brain involved in stress response and emotional regulation may function differently in individuals with PTSD, potentially contributing to the disorder's development. And genetic factors may influence an individual's susceptibility to PTSD, affecting how they respond to stress and trauma. So social and environmental factors, so positive social support and a strong community can act as protective factors. So the first thing what we do in any mental health disorder is we say that grow a social support network. That means people who you can trust, your close family members, your close friends or close colleagues who you can trust. And the people who have the same, once you go to psychotherapy, you will have support groups. That means people who are suffering with same mental health disorder as you, or as the person, will get to meet and share their experiences with the similar mental health disorders. So what happens is they can share their experiences, they can share their treatment journeys and how did they recover. All makes them strong. So it will give help them to recover from. This is in general for every mental health disorder. See, incidents, I already talked about incidents that women are, generally it may be developed in any age, but women are more prone to develop than man. Usually 6 to 7% of the population experiencing stress have stress because of the post-traumatic stress disorder. So, this is, and the here the signs and symptoms I will discuss in detail. We have discussed about the symptoms in brief. So in detail, intrusive symptoms, I've talked about intrusion symptoms. So what is intrusion symptoms is these involve relieving the traumatic event. They may include distressive memories. So as I said, as we all whenever we experience trauma, some it is natural to feel afraid of it, it is natural to be distressed of it, but these people cannot forget and move on. So they always have distressing memories even after months of the incident have passed. So they will have flashbacks, they will have nightmares, they will have intense psychological and physiological reactions. As I said, they will have physical symptoms as well. They will they are always triggered by the reminders of the trauma. They always get the reminders of the trauma time to time. They experience all of these. And I said the avoidance symptoms, we talked about the avoidance symptoms because individuals with PTSD often try to avoid anything that reminds them of the traumatic event. So negative changes in the cognition and mood. See, people with PTSD might experience changes in their thoughts and feelings. So they can include persistent negative beliefs about themselves or the world, distorted feelings of guilt or blame, feelings of detachment from others, difficulty experiencing positive emotions, and a diminished interest in previously enjoyed activities. All these we have discussed. So then changes in the diagnosis. How do we diagnose? Is one is we do clinical interview of the patients when we do the consultations, and we have DSM, that a diagnostic and statistical manual of mental disorders. There is a manual called the diagnostic and statistical manual of mental disorders. So we now it is DSM 5. That from that as well we diagnose PTSD. And duration of the symptoms, the symptoms persisting a month or more than a month, functional impairment, all these criteria we see. And we rule out other symptoms, other conditions, because it might be confusing sometimes to get to the diagnosis. And severity is also there: mild, moderate, and severe. Or everyone will not experience severe symptoms. There may be mild symptoms, there may be moderate symptoms, and there may be severe symptoms. According to it, treatment is prescribed. Now we will see what are the effects on the mind, cognitive and emotional. What happens when a person has PTSD? How does it affects his or her mind? As I said, intrusive thoughts and flashbacks. So they will have the thoughts, memories, and the images of the traumatic events. They visualize them all, and they have hyper arousal. That means people with PTSD often have heightened sensitivity to their environment, that is, leading to constant vigilance and exaggerated startled response. They are always, if you just, they can be easily irritable, easily aroused, easily they get angry, or easily they might get aggressive as well. And avoidance, as I said, avoidance, this also affects the mind: negative thoughts and beliefs, emotional dysregulation. All these leads to what happens is there is dysregulation. Emotions are not in control, so there is no emotional regulation. What happens is people with PTSD might experience intense mood swings, irritability, anger, outbursts, or difficulty managing their emotions. So, what are the effects on the body? All these are the effects on the mind. So, what are the effects on the body? Are there any physical symptoms? So, PTSD can cause a variety of physical symptoms, including, headaches, stomach aches, chest pain, muscle tension. These symptoms can arise due to body's, heightened stress response. There may be headaches, symptoms like headaches, abdominal pain, chest pain, muscle tension, sweating, increased sweating, increased heart rate, and they might experience palpitations as well. And as I said, if in every mental health disorder, one common thing is there is a sleep disturbance, there is an appetite disturbance, and there is a sleep disturbance. Sleep problems are common. Insomnia, nightmares, and night sweats, because the thoughts are running continuously in their mind, the sleep is disturbed. And hypervigilance is really important. That means individual may be constantly on the lookout for potential threats. मतलब हर वक्त उनको यही रहता है मन में, मतलब जहन में, कि कुछ ना कुछ अभी गलत होने वाला है। वो हाइपर हो जाते हैं, हाइपर विजिलेंस बोलते हैं उसको। मतलब अगर किसी ने डोर बजाया तो उनको लगता है कि अरे डोर बजा के ये तो हमें मारने आने वाले हैं, ये इवेंट फिर से रिपीट हो सकता है। It may what it does is the hypervigilance makes it difficult to relax and concentrate. This state of hypervigilance can lead to exhaustion and difficulty focusing on tasks. What happens is the hyper vigilance often leads to exhaustion, मतलब जल्दी थक जाते हैं वो, and it makes it difficult to focus on tasks. So, and all these are the symptoms. And what happens is, as I said, to for coping from the stress that is occurring due to that trauma, what they use is they fall they will be trapped into the substance use or alcohol consumption or tobacco and self destructive behaviors. Some individuals may turn to alcohol, drugs, self destructive behaviors like suicidal tendencies or self harm or harming others, whatever it is different for different individuals. So it has a significant impact on mind and body, and the overall well-being is affected when a person experiences a post-traumatic stress disorder. So it is very important to seek professional help at this part of time, because the quality of life is being compromised here. So now I will talk about some types and forms of PTSD, so that you can know that okay, this is PTSD. That means this is due to stress. The stress is due to the trauma. So combat related PTSD, as I already told, that PTSD came into existence because of the combat war veterans. So a soldier who served in a war zone witnesses the death of a fellow soldier and experiences constant threat, leading to intrusive memories, hypervigilance, and nightmare even after returning home. So, and sexual assault related PTSD, this is also very common. A survivor of a sexual assault struggles with fear, anxiety, depression, constant feeling of threat. The person also becomes hyper vigilant due to recurring memories of that assault. It may be a physical assault as well. In childhood as well, somebody is constantly beating that person. That person is experiencing physical violence. She or he avoids that situation, that reminds her of that trauma, and has difficulty trusting others. The trust issue becomes very much difficult. And as I said, natural disaster related PTSD, see, someone who survives a hurricane and loses their home and experiences distressing flashbacks. There may be a volcano, there may be hurricane, there may be a earthquake. What happens is this, they cannot forget that incident. They lose their home or they lose their loved one, and they always experience the distressing flashbacks, anxiety whenever they hear thunderstorms, as they associate them with the traumatic event. Childhood related trauma, this is very common. In childhood, they might have experienced some assault, some type of assault or abuse, and it is not affected them when they are children. It is affecting them when they are adult. So an adult who experienced physical abuse as a child struggles with low self-esteem, shame, and emotional dysregulation. So what, they develop avoidance behaviors. That means they avoid certain social situations due to fear of rejection or fear of threat, whatever. Medical trauma related PTSD, this we have not talked about. That means a patient who underwent a life threatening surgery, complex surgery for cancer or something. What happens is experiences nightmares and panic attacks triggered by hospital settings. It is triggered by just when he travels, if he sees hospital, that surgery triggers him. Or if he sees a doctor or nurse in the family when he's all right, that also triggers that trauma of going through the surgery, so leading to avoidance of medical care. Next time he has some physical suffering, if he has some physical problem, he will not approach the hospital, or he will not take any medical care. So that is the avoidance nature. Next, first responder related PTSD. So this is something new. That means, for example, a firefighter, there is a firefighter who witnesses traumatic accidents and disasters, develop symptoms of PTSD. He is not the victim, but he has witnessed it. The first responder is a witness. He is not a direct victim, but he has witnessed traumatic events or the bad happening to people there. So that person might develop PTSD. He might develop irritability, he might develop emotional numbness, and it becomes for him, he avoids certain events, or he avoids going to work, and it is difficult. It interferes into his daily life. It becomes difficult for him to maintain, him or her to maintain relationships. Next is accident related PTSD. We have already talked about it. That means, if there is for example, there is a survival of a car crash who experiences distressing memories and nightmares about the accident. So they feel on the edge and avoid driving or being in vehicles. Next time, what they do is they cannot drive a vehicle if they've experienced. And this might be, they might self be a victim, or they might have witnessed a car accident. That also might happen. They just might have witnessed something. It has not happened directly to them. Then also they might develop accident related post traumatic stress disorder. Then this is witness related PTSD. This is the same as we talked about it. If a person is a witness to a violent crime, or a violent hazard, then what happens is, this person, if मान लेते हैं कि किसी a person has seen a murder, a witness to a murder, a horrendous murder. So that person experiences intrusive thoughts and heightened anxiety, so they avoid the area where the crime occurred. So they will avoid, going alone, or they might avoid that place, they might avoid that city, altogether, or going alone. And next is terrorism related PTSD. That means a survivor of a terrorist attack. We recently had a client who was a survivor of a terrorist attack, experiences intense fear and panic attacks whenever they encounter large crowds, whenever they see large crowds, public transportation, or busy urban areas. They always experience terror attack. They always feel that they become hyper vigilant, and they feel that something wrong is going to happen, even it might be completely unrealistic. So all these are the types and forms of PTSD. That means how differently PTSD can develop. So, if you ask me what is the treatment is the therapy here. Main treatment is the therapy, the talk therapy, the cognitive behavioral therapy. The treatment is also, elaborate. It takes time. So, we'll discuss the treatment section of it in the next session. So, because it will take time. So for in brief, I can say that psychotherapy, mainly the psychotherapy part, mainly the psychotherapy plays an important role in the treatment here in the post traumatic stress disorder. So, what happens is, cognitive behavioral therapy, there are sessions which, group therapies, all these therapies, or combined therapies, all these therapies are, administered, and there are so many cognitive exercises, exposure therapy, all these are done, and cognitive restructuring, all these are done in the treatment. We will discuss the treatment with case studies in the next session. So, thank you for staying tuned, and I'll be back in the next session. And meanwhile, if you have any topics for me to address, please share it in the comment section, and share your thoughts if you have any in the comment section, so that I get to know that how is the content, and how are you liking it, what more do you want me to do. So thank you, and namaste for today. I'll be back in the next session.